Hello, and welcome to this web series dedicated to sharing key insights on tools and technical assistance based on the work that was done in collaboration between BCG and California counties between fall of 2025 and summer of 2026. Today, we're going to be focusing on collaborative documentation, a practice that is increasingly important for clinicians working under CalAIM and new federal regulations. Whether you're brand new to this concept or looking to sharpen your approach, this session is designed to give you and your staff practical tools that can be used right away. We have about 30 minutes together, so let's dive in. Here's what we'll cover today. We will start with why collaborative documentation matters, particularly in the current policy environment. Then we'll move into what it is and clear up some common misconceptions. From there, we'll walk through how to implement it, practical workflows, language that can be used with clients, and how to adapt. And finally, we'll talk about when to use it and when to pull back. By the end of the session, our goal is that you walk away with a clear understanding of the value of collaborative documentation and a couple of things that you can suggest to staff to further improve processes. We would like to give special credit to the LA County Department of Mental Health Training Team, as well as Bill Schmelter, SAMHSA, and the National Council for Community Behavioral Healthcare, who have created materials that we reference here. We encourage you all to view those publicly available resources in addition to watching this video. And please note that these materials have been adapted for specific county contexts and that they should continue to be adapted to fit your own. Let's start with why the collab team made collaborative documentation a priority across counties. There are two big drivers here. The first is going to be CalAIM payment reform. Under CalAIM, providers can no longer bill separately for documentation time, and only direct client care will count toward the billable service duration. This is a really significant shift, as you all know. Only direct client care counts. And so what that means is that if you're writing notes after hours or between sessions, that time is going to be invisible. It doesn't generate revenue, and it can contribute to clinician burnout. And collaborative documentation changes that equation because the note is being written with the client in the session. You are not losing that time anymore. You're actually able to capture it. And tied into that is really this driver of documentation quality and provider burden. So a lot of the exhaustion that clinicians that we have interviewed have felt around documentation really does come from doing it after the fact. So relying on memory, catching up during no-shows, and just trying to clear a long backlog. And when they can document in the moment, then that information stays fresh, notes are more accurate, and in some cases, compliance can improve. Most of you already know why documentation matters, and I just want to acknowledge that before we go any further. So accurate, timely documentation is really the backbone of quality care. It supports compliance with county, state, and federal standards, communication across the care team, record keeping that clients can access, and sustainability, because ultimately, good documentation and proving that those services happened is going to be what justifies funding for the services and at a greater scale, the provider workforce. Collaborative documentation does not replace any of those fundamentals in any way, but it helps and it can help to improve accuracy, involve clients more deeply in their own care, and also reduce burden on providers at the same time. So what exactly is collaborative documentation and why should you consider introducing it to your staff? Let's define it clearly. So collaborative documentation is going to be the practice of completing documentation during the session with the client present and engaged. Really critically, it's not just an administrative task, and it should never turn a session into a pure exercise in documentation, right? The clinical service is still the priority. And what that looks like in practice is writing key elements of progress notes or assessments during or at the end of the session. There's some variability in how you can make the best use of time, explaining the documentation requirements to the client, really being transparent. Also making sure that they can see what is going on. And so this is just a way to increase transparency and use the documentation process as part of the therapeutic conversation where appropriate. And what it does not include is going to be writing process notes, including suspected diagnoses and in front of the client without context, using a lot of jargon without explaining what exactly that means, documenting without asking for the client's input, or, and this is really critical, but documenting in emotionally intense times. And that last point is really worth emphasizing. Collaborative documentation is a skill and it requires clinical judgment. And if a client is in crisis, then the note can wait, right? This is a technique that is just part of the toolkit and absolutely not necessary. So when you compare collaborative documentation side by side with traditional documentation, there are meaningful differences across three areas. So first, person-centered care, on quality and compliance, and then the final piece on provider time. So when it comes to person-centered care, traditional documentation really reflects only the provider's interpretation, and collaborative documentation invites the client to give their perspective as well. When it comes to quality and compliance, traditional notes are really memory dependent. Details fade, notes are more likely to be late or incomplete. It can be really hard for some staff to meet a 72-hour deadline because things get busy, and documentation sometimes takes a backseat to client care. And so collaborative documentation captures that information well. It's still fresh, which can improve accuracy and timeliness. And when it comes to provider time, traditional documentation takes time out of a provider's day, and many clinicians really rely on no-shows to catch up on documentation. And so collaborative documentation allows notes to be completed during a session, or in the final few minutes of a session, which really reduces backlog and can even free up time for more client-facing work, which is why everyone got into the work in the first place, right? Not to be documenting, but to make an impact on clients' lives. And beyond some of the clinical benefits that we have heard from clinicians, that there are also adaptations based on regulatory changes that are, supported by collaborative documentation. So first, CalAIM, and then also the 21st Century Cures Act. So CalAIM, as I mentioned before, removed the ability to claim documentation time separately, and collaborative documentation, which is done with the client as part of that therapeutic service, can count as billable direct care. When it comes to the 21st Century Cures Act, that gives clients the right to access their clinical records. And so collaborative documentation really builds the transparency into the session itself. And importantly, what we've heard from certain counties is that when clients are part of the documentation process, they are less likely to contest what is written in a progress note. So, these two reforms are not just compliance checkboxes and collaborative documentation, along with starting to help organizations fall in line with some of the financially centered reforms, can also represent a shift towards more transparent and person-centered systems, and collaborative documentation can help systems to adapt more proactively as you consider some of the new technological advances that kind of remove the need for this at all. So ambient dictation and AI-supported progress notes. So There are very real concerns that come along with introducing collaborative documentation as a tool for your clinicians, and those are very valid concerns, of course, right? So some providers worry that collaborative documentation takes away from treatment time, and all of these are things that you should keep in mind as you consider implementing collaborative documentation as a suggested tool for providers to use. Others feel that there are no clinical benefits to completing documentation with clients, and there is some research that SAMHSA and Bill Schmelter did that shows that using this technique can actually increase engagement, reduce no-shows, and improve medication adherence, which is a really clear clinical benefit actually to using this technique. And when it comes to getting in the way of being present with clients, the research suggests that you can really capture key statements in a different way that might otherwise be missed, and can even start to reduce some of the vicarious trauma that can come from completing documentation after the fact. And so when we think about the final point, which is that some clients need a chance, or excuse me, some clinicians need a chance to think through what they write before completing a note. There's also the consideration that thinking through some of those next steps can actually help you to organize the thoughts, and really be collaborative with the client to determine what are the right next steps and what's going to push forward on that treatment plan. So, how can collaborative documentation be implemented and incorporated into actual workflows? One thing to consider is how the space is set up. So the first thing is what the physical environment looks like, and that can be more important than people might expect. So in an office setting, shifting furniture so the client can comfortably see your screen, just even angling towards them. And what you want to really avoid is a dynamic where you are fully turned away from the client. And this is something that the LA County Department of Mental Health really noticed, and brought out in their training. We think it's important to bring up here as well. And so and when in a community-based setting, like many services are provided today, what this can look like is instead bringing a notebook, reading aloud rather than, trying to read from the same piece of paper. And something to know, which is really important, is that clinicians should always be prioritizing their safety. Collaborative documentation does not necessarily require sitting directly next to a client, and just make sure that clinicians still use their judgment about what positioning makes sense given the context. So for services where you are writing progress notes, you can think of this in a structured before, during, and after workflow that many clinicians find helpful. So before the session, ensure that there is a plan for introducing the technique to clients that haven't experienced collaborative documentation before. Be prepared to ask questions, have some phrases ready to explain the process and some of the benefits. During the session, you can use those first 5 minutes to greet the client, review progress note, and the problem list from the last session. And this can accomplish two things. It can orient the client and model some of the transparency that clinicians aim for. And then the session can be conducted normally. If clinicians prefer, notes can be taken by hand, or key statements can be flagged out loud. And then in the final 10 minutes, if this is how the clinician chooses to do it rather than, throughout the session, you can write down those key elements. So aligning on the problem, the intervention, and the response. That's a really familiar progress note template that many people use. It can also be used with, a burp note or a soap note, really any template that is most comfortable. And then after the session, you can clean up the narrative, right? Add any process notes that maybe weren't captured in front of the client, filling in the clerical elements like the duration. And the structure is designed to be adaptable. So as clinicians get more used to it, they'll find their own processes. For assessments, the structure looks a little bit different. And actually, this is a great place to start practicing collaborative documentation because it's really similar to how many clinicians already conduct assessments. The format is already much more back and forth, specific questions and writing it down. So the same couple of steps of preparing during the assessment, taking into consideration asking questions, waiting for the client to respond, and then reading notes back and incorporating their feedback if it makes sense. And again, if sometimes clinicians like to introduce this suspected diagnosis when it comes to the assessment based on our interactions with folks at the county level. Sometimes it's just really clear to maintain plain language and use best clinical judgment. And then the after steps are going to be the same as progress notes, cleaning up their narrative, adding back clerical details. So there are some different ways that you can introduce collaborative documentation with clients, and I won't go through all of these, but really the intention here is to just have clear communication with clients and understand exactly what it is that you are proposing to them when you suggest collaborative documentation as a new thing that you're going to be trying in sessions. It can also be helpful to be prepared to respond to some client concerns. And so these are a couple of ways to respond to that. But again, it will truly be up to the clinician and their best judgment. There are also many considerations about how this should look for children and youth clients, and you won't want to use types of the same types of language, right? It is always a different communication style. And then really the key thing is knowing when to use collaborative documentation and keeping in mind again that clinical judgment, which is really key to this process. So in some cases it's going to look different, right? You may disagree with a client about what is being written in a note. So you can agree to disagree. That's a totally fine thing to do. Really fall back on your clinical judgment. Be very transparent about what is happening. There is going to be a progress note written either way. You can do it together or you can do it apart. And then the final part is just to remember that really any collaborative documentation is going to be better than none. So clinicians do not have to get it right on their first try. They do not have to have a perfect progress note by the end of the first session where they're using collaborative documentation. But really what we want to do is just start to build the muscle and really add a skill to the clinician toolkit as an option. Thank you all so much for listening. There will be materials posted.